But I have the unfortunate placeholder for be the last one that's preventing you from get to lunch. So I'll try to make this quick. But I think this is an important topic in clinical research to at least briefly discuss ethical and regulatory considerations. So on your journey from idea to publication, you are still working in this planning phase. You've got an excellent protocol. You've spent all this lovely time with your biostatisticians. You've got a great database set up. But before you can get started, there are regulatory documents that are required. And ethics in research and the regulatory issues that they surround are very important. So let's talk about what are ethics. So ethics are norms for conduct that distinguish between acceptable and unacceptable behavior. We've got lots of examples of ethics in religious texts or philosophical texts, right? We've got the golden rule, do unto others as you would have them do unto you, right? It's not that easy in medical, but in medicine, we do have the Hippocratic Oath, right? First, do no harm. This oath is an oath of ethics that's traditionally taken by physicians that outlines professional conduct. And the Hippocratic Oath, the original text, actually had physicians swear to certain healing gods that they must uphold specific ethical standards. But the Hippocratic Oath actually might be the earliest expression of medical ethics in the Western world. But nowadays, most societies use laws to enforce some widely accepted moral or ethical standards. But I do want to emphasize from this presentation that ethics and laws are not the same. So an action may be legal, but might be considered unethical. So in research, we expect people to disclose financial conflicts of interest, right? There's no law requiring them necessarily to do so, but we accept that as a standard amongst clinical researchers that we need to know if you have financial conflicts of interest. Similarly, an action might be considered illegal, but ethical. This one tends to get a little bit more controversial for examples, but it could be something as simple as you have pain medication that's been prescribed to you by your doctor, and you have a family member that's suffering. You might decide to share your pain medication with them. It's technically an illegal act, but you are doing the right thing from your ethics, morals, and moral standards to help your suffering family member. Now, ethics in clinical research has evolved over the decades, but ethical principles are important for a variety of reasons. First and foremost, if you've learned anything today, is that clinical research is a team sport. There is a great deal of coordination and cooperation that goes on in clinical research, and ethical standards help promote values that are essential to that collaborative work, like trust, accountability, mutual respect, and fairness. You might be able to work great with your team members, but you're often going to have to work with people with other disciplines, other departments, other organizations, or maybe even other countries. And having clinical research ethics helps to build those cooperations. Also, ethical norms in research really help to build public support for research. And when people see unscrupulous research being done, it can really erode the public's trust, and that can have really profound and lasting effects. One example of this is a gastroenterologist or autism, I'm not entirely sure. But this study was actually later retracted 12 years later when the British General Medical Council, which is similar to what we have as the AMA here in the United States, because he as an investigator acted unethically. They found that he was unethical in the selection of his participants, the tests that he administered to those children, as well as the lack of financial disclosure, including money that he received as an investigator from lawyers who were acting on behalf of parents that were trying to sue these vaccine manufacturers. So the type of harm that was done cannot necessarily be done easily. And given the importance of ethics in conducting clinical research, many professional associations, government agencies, or universities have specific codes, rules, or policies related to research. Now, what I just described was clearly a high-profile case, and thankfully these things don't happen every day, but there's many facets of ethics that come up in our day-to-day work. Of these, some of them are listed here. We have honesty and objectivity. When we design clinical research studies, we try to make them as objective as possible. But ultimately, some judgment calls will find its way into our trials. For example, in drug study designs, where they're supposed to be very specifically and very rigorously followed, oftentimes it is up to the investigator to decide if an adverse event that was experienced by a patient in their study could be attributed to that new drug, right? So it's up to the investigator to decide whether or not they think that side effect could be because of this drug. And if that physician is not acting in an honest or objective manner, you can damage the clinical integrity and the ethics of that study. Integrity is important. You must be able to do the right thing even if nobody is looking, right? You cannot take shortcuts or do sloppy work when it comes to clinical research, because forging information or just, copying something from somebody else could hurt people based off of the information that ultimately comes out in the study. So if you work at a bank, you decide you're not going to file some paperwork, or maybe you just, closed out something, you didn't do what you're supposed to do. Company might lose some money. Maybe there'd be a fine incurred. Maybe you'd get reprimanded, but people are not going to be harmed or potentially not get life-saving therapies because of an error or an oversight that you made. Confidentiality in research is obviously hugely important, as it is in all medical care, but competence is also another interesting ethical principle to consider in clinical research. Are you the right person to be studying this topic? Do you know what you're looking for when you're trying to investigate a clinical question? If you're not an expert in this area, maybe you aren't competent enough to be doing this study. At the top of the next column, we also have responsible publication, which can include a whole host of things. But it's also making sure that people who are doing the study get the proper authorship and getting the credit that they deserve. Responsible mentoring and respect for colleagues really goes with that helping other investigators or members of your team in good faith, right? You have to act in a way that helps them and not just prioritize yourself, which can be really challenging because in the world of clinical research, it can also be very competitive. We work in situations and certain employees have to publish a certain amount of information as part of their job, which can create a very competitive environment. When it comes to non-discrimination, we have to make sure that we're designing studies in such a way that the risks and the benefits are shared equitably. And that brings me to my last topic, which is what we talk about usually the most when it comes to researching or ethics in clinical research, and that is human subjects protections. The legal aspects of all of this underscores all of these areas in ethics, but we tend to focus heavily on our laws, focusing on human subjects protections. But it kind of makes you wonder, right? Like, do we really need laws to protect research subjects? Because after all, the oldest surviving copy of the Hippocratic Oath that says first do no harm dates back to the 3rd century AD, right? So by the 20th century, surely this will be just a morally ingrained code that we all conduct with. And of course, that is not the case. So the Nuremberg doctors' trial that occurred at the end of World War II is generally cited as the incident that drew attention to the need for a formal system for human subjects protection. German doctors were tried for war crimes as well as crimes against humanity for what they did to their fellow humans and unwilling research subjects. The Nuremberg Code was published shortly after the doctors' trial in 1945, and that outlined 10 points on ethics of permissible medical experiments. Some of these points included you have to have informed consent, and you have to conduct trials in a way that minimizes unnecessary physical or mental suffering. The Nuremberg trial then prompted the National Institutes of Health in the 1950s and 60s to establish that is required approval from a protection of human subjects review panel, thus spurring the establishment of IRBs, or institutional review boards. So you may be thinking, great, that was an end to a very unfortunate era. Everybody's learned their lessons. We've got processes and protections in place, and that settles that. We certainly won't ever have history repeat itself. But unfortunately, in 1972, the Associated Press uncovered a story of an ongoing clinical trial that was so egregious that to this day, it is discussed in every research ethics class, including this one, which of course is the Tuskegee syphilis study. The study was originally called the Tuskegee Study of Untreated Syphilis in the Negro Male, and it was a government-funded study that began in 1932. Now, back in 1932, we didn't have any treatment for syphilis. So if you remember, this would be a cohort study where we followed approximately 400 Black men with syphilis and 200 Black men without syphilis to explore the natural history of that disease. These individuals were not told what they were being studied for. In fact, they were told they had bad blood. And in exchange for participating in this study, they were given free medical exam, free meals, and burial insurance. Now, the problem with this study is that by 1943, penicillin was widely available. Penicillin to this day is the drug of choice for syphilis. And yet these participants remained untreated until 1972 when the Associated Press broke this study. The exposure of this study led to the establishment of the National Commission for the Protection of Human Subjects of Biomedical and Behavioral Research. That committee published recommendations that are known as the Belmont Report. The Belmont Report that was published in 1979 establishes 3 ethical principles to guide the conduct of research that involves human subjects. These are respect for persons, beneficence, as well as justice. Respect for persons means that individuals need to be treated as autonomous agents who can make their own decisions. It requires informed consent, which seems to be a repeated theme. It also demands that we respect the privacy for research subjects. The principle of beneficence means that we must minimize harm while maximizing benefits. We have to make sure that the researchers are able to perform the studies and manage the risks. And it also prohibits research that was without a favorable risk-benefit ratio. And lastly, the principle of justice means that people need to be treated fairly with the design so that the burdens and the benefits are shared equitably. And we must avoid exploitation of vulnerable populations or populations of convenience. It also describes that any activity that is a research on human subjects needs to be reviewed by an IRB. So research is defined as a systematic investigation designed to develop or contribute to generalizable knowledge, right? And a human subject is a living person in which we gain information from. Now, the difference between medical practice and research can sometimes be confusing. It gets even more conflated when we start to consider what is medical practice, what is quality improvement projects, and what is research. In general, if it is designed to contribute to generalizable knowledge, it is considered research. Your activity is research. But sometimes we might be collecting data on patients, trying to improve what we do in a hospital. We want to see if a new drug that we're using in patients is really getting our patients out of the hospital faster, or we've got a new device that's going to reduce our surgical site infection rates, something along those lines. And collecting data, collecting private health information, kind of does start to feel like research. However, if it is used for internal purposes, not necessarily research. But if you have any questions about whether the activity that you are doing is medical care, quality improvement, or research, you should talk to a member of an IRB that they can help guide you. If there's any doubt, it is up to the IRB to decide what is or would not be research. So when you submit an activity for review by the IRB, there are 3 different review options that they can do for you. These are exempt review, expedited review, or full review. If the IRB determines that you qualify for an exempt review, you are exempt from most federal requirements that are stipulated by an IRB. It doesn't get you a whole lot, but it does also mean that you do not necessarily have to do yearly oversight with the IRB. But exempt review is only qualified if your activity poses no more than minimal risk to the participants, and it fits into one of 8 defined categories. Some of these categories include educational research or some select surveys or interviews. Importantly, this category also includes secondary research, which is data that was collected for some other initial activity that meets other stipulations, such as it's been totally de-identified. So maybe you did a quality improvement project, you've de-identified everything, there's nothing linkable. This may qualify as exempt research. Another category is also the use of biospecimens, so something that was part of an ancillary study. If these specimens have been de-identified, it could be a secondary research study. Or it could be information that's publicly available, such as a database study. Being exempt from federal requirements does not mean you are exempt from any state or local requirements. And it's ultimately the IRB that will tell you what your requirements are and whether or not that alters your process for informed consent. The second category I mentioned was expedited review. Again, with this category, your activity must pose no more than minimal risk to the subjects, and it must fit certain category as defined by federal regulations. A common example of expedited IRB reviews are cohort studies, simple observational studies, particularly retrospective cohort studies, where all the information has already been done in the past, and we're just obtaining information from patients' medical records. And the last category I mentioned was the full IRB review. This is for situations where your activity does pose more than minimal risk. So anytime you have a new drug, new device, new procedure, this is going to require a full IRB review. This also is for research that is going to be conducted in vulnerable populations, like in countries that may not have the same federal oversight for protection of human subjects or things like children. Now, the IRB will also determine how and when and where informed consent can be done, and it is up to the IRB to decide whether or not you can waiver or alter that informed consent. No matter how much of an experienced researcher you are, you cannot decide for yourself, I've done this type of study in the past. The IRB always says that I can just waive the informed consent. It's just a retrospective chart review. That is not up to you. It is up to the IRB, and all work is required to be submitted to the IRB. I will say one thing that the IRB does not do, they do not catch errors in your study protocol, right? If you thought, man, these like statistics guys were really intimidating, like I don't want to ask him if I should use a paired t-test or an unpaired t-test. I'm just going to pick one and hope the IRB tells me what's the right to do. That's not the role of the IRB. The IRB is there to protect human subjects. So in conclusion, ethical conduct in research goes far beyond the legal requirements. It really defines and helps maintain integrity of scientific information. And it's really foundational to clinical research collaboration. And I will say this again, the IRB exists to protect human subjects. If you would like to read more about ethics in research, I have a couple of references here on the slide. The first is CIDI training. They have a lot of great review courses for any of these principles that may not be as painful as the first time you had to take CIDI training. But if you want to read more technical specifications, I have a couple of websites for the NIH and the Office of Human Research Protections. This has a lot to do with the federal requirements that I mentioned before. Lastly, I also included a book that has a really good overview of on how to navigate some of these ethical concepts, not necessarily the technical ones. I also want to encourage you that if you do research in specific areas or specific topics, there's a lot of publications out there that'll help guide through some of the more niche ethical principles. So what we talked about now are sometimes just human interventional studies, but there's a lot of different ethics involved with human genomic research or psychological research or research in children or even accessing data, whatever it may be. There's going to be a lot of different opinions and ideas out there. So find some other articles that help define those norms for you. With that, we'll end a little bit early so we can have some lunch. Thank you.